Hello, everybody watching us on KTV2, and welcome to another episode of The Untold, where we learn about people's journey through life. And today we have with us Dr. Abdulrahman Alkandari, a urologist, Abdullah.
Yes, we have a Dr. Abdulrahman Alkandari, urologist, which is a topic, I believe, if I'm not mistaken, it's the first time we've had here on The Untold. So I'm sure it's going to be a very interesting conversation. We are going to learn so much from this episode. Hopefully, the audience can learn as well. We are going to take a break and come back with Dr. Abdulrahman Alkandari.
Dr. Abdulrahman Alkandari, welcome to the show. Welcome to The Untold.
Thank you. Thank you so much for you and for the team for this interview.
Well, all thanks goes to you. You know, every time we have doctors here on The Untold, it's always a privilege for us because we know how busy you are with your lives, with your patients. So honestly, we do appreciate you coming here. Now, on the topic of being in the medical field, what first inspired you to go into the medical field and study this kind of field?
First of all, it's always like I've been always wanted to specialize in something that may change, may make any change for the patient's life, patient suffer stuff. So definitely the encouragement of my parents also helped me to choose the medical field in general. And during our studying, we used to do some rotations in multiple specialty, including urology. Once we enter the urology, we noticed that there is a very big variety in this specialty in terms of we can do medicine, we can do surgical procedure to the patients. The way that the surgery is going on, it's some sort of high tech since long time ago, actually, in the urology field. So this is what was the trigger to be a urologist.
That's amazing, Dr. Abdulrahman. What would you say was the defining moment that made you the doctor that you are today?
So basically, it was multiple moments rather than a one moment that make me continue and put a lot of efforts in this field. You know, multiple patients coming to your clinic suffering from whatever the issue in my specialty, either a renal colic, which is very severe pain for the patients, or a difficulty in passing urine. When you help them, they really pray a lot for you.
Well, that's amazing, especially when you feel appreciated by the people and you felt like you actually helped someone make their life better, especially for maybe urology is specifically for men. And I think that's actually an inspiring moment, I would say, Abdullah.
It is, yeah, honestly, you know, to take a path that helps so many people is always a blessing to be had.
So, Dr. Alkandari, what was the greatest influence on you as a doctor?
I would say like changing patient's life is a really a good moment for any human being, specifically when a patient coming, especially in our community, when they come with their family, a big suffer, regardless the reason, either pain, cancer, for example, or a difficulty in passing urine, treating them with medicine or surgery, and make them really appreciate that, you know. So this is actually the moment that you make for them and for yourself.
Was there like a specific person who influenced you during maybe your studies or during your work as a doctor? Maybe you were inspired by someone in this field?
Multiple. I would say first family, definitely the family support, either from the parents or wife or kids. And we as a doctors and specifically as a surgeon, our life is a bit busy. So working in the morning and evening, sometimes call duties. You know, you need someone to really understand the way that you work and busy. The second is definitely the mentors. So during my journey, either locally or internationally, I met a lot of mentors who really spent time teaching me the surgical technique, the way to talk to the patient, professionalism. So it's not about ethics, it's not about only the way that you operate. Also, your attitude as well is really important. So I really appreciate their effort with me in terms of mentors.
I think it's really a noble path to be a doctor because it takes a lot of your time. I think maybe only to get a degree in being a doctor, maybe it takes maybe 8 to 10 years to actually get a
12.
degree. 12 years, that's actually more than
Especially if
tough.
you like continuing, because we do have also a fellowship training That's after the medical school and then residency program and then a fellowship. So to reach up to 12
It's actually
years.
12 years, but you actually start working before that, if I'm correct.
That's 100% correct.
And actually take a lot of your time and maybe your family's time and to be with people, to help people. That's why I think it's really inspiring to be a doctor.
Now, Dr. Kandari, when it comes to this kind of field, it has, I'm sure, a lot of difficulties, a lot of challenges. So I do want to ask you about some of these challenges that you faced along your path.
Correct. So the most, in my opinion, the most tough thing in this is to combine the work with the studying. And this is what we call the residency period. So in this period, we spend 5 years work in the morning, study in the evening. So and you have a family duties as well. So it's a really tough period for any doctor to finish this. After you finish, you just concentrate more in the work more than studying. Definitely you have to read the updates, studies. But in general, like this 5 years are really tough years.
You were talking about the last 5 years of medical school, correct?
No, I'm talking about after the medical school.
After the medical school.
Yeah, after the medical school, we join a residency program. And this is the specialty itself, in general specialty. And then we do have something called the fellowship, which is subspecialty of our specialty.
Like I was saying before, I think being a doctor is not an easy path to take in life, especially as it takes from your time and maybe your family time and maybe different people in your life. You just focused on your job, helping people and being in the hospital most of your time in the day. But Dr. Alkandari, what is the biggest challenge that you faced in your career and how did you overcome it?
In my opinion, the biggest challenge that all the urologists may face is the surgical decision intraoperatively, because sometimes you do a major surgeries and you need to take a decision within seconds. This decision may change the patient's life. So this is one of the points that I think the surgeon should have some sort of braveness and a good attitude that he can take this decision, rather than the knowledge, rather than the skills.
I think that was well said, doctor, especially the courage, because every choice you would take maybe affect this person's life for the rest of their time. And I think that's a really brave thing to do.
It is, yeah. I think, being in the medical field is one of the most courageous, fields someone can take. Now, you did mention a lot of your mentors, taught you how to deal with patients, how to talk to patients. Now, of course, something like that's not within the books. It's by the mentors themselves. So when it was your time to talk with patients, to deal with a lot of these mental taxations, a lot of these mental difficulties in taking a case by case, telling them good news, bad news, how did you approach all of this?
Definitely, like you will have some challenge after being independent in the clinic. When you want to tell a bad news, especially for example, patient discovered to have a cancer, and this is one of the bad moments that you will tell the patient that, sorry, you do have a cancer. So in the beginning, maybe some terms that you use is not appropriate, and then with experience, you can reach the format that will be like suitable for the patient and for you as well.
I think this is especially a devastating moment for the person when you tell them that. So it also takes a lot from you to actually deliver the news, and you have maybe to learn different ways or different techniques to actually tell the people what they have or the different symptoms or maybe diseases that they have. But Dr. Abdulrahman, can you share a difficult case that actually taught you a lesson while respecting the patient confidentiality?
I would choose something like in the clinic rather than in the OT. So it's one of the patient that we discover cancer for him, and one of our trainee was in the room. I wasn't with him because we do have a training program as well. So the trainee usually they spend some time in the clinic, in the OR, and under our observation. And the way that he expressed and delivered the message was bad, and that reflected in the patient himself. He got collapsed from it. We have something called vasovagal attack, and this has happened to any people when he listen a very bad news, or when he got severe pain and the patient got collapsed. And it was a message for me and for the trainee that the way that we deliver the message is very important.
And now when it comes to the way you approach your work, now of course it relies on a lot of these technologies, a lot of these machines. Can you talk us a little bit more about the developments in your field when it comes to all of these things?
Okay, so urology in general has a very nice technology, AI. We use the AI a lot for the operation, for the research. We do have technology in terms of robotics. We do have a robotic called Da Vinci. We are urologists in general, the first or the second specialty in medical who is using the robot. In terms of lasers, we are very developed in laser. We have multiple types of laser, holmium, tholium YAG. Using of laser technology, like giving the privilege of decreased bleeding, improve the surgical outcome, less complication because the field of effect of the laser is very minimal. When you're using for delicate tissues, it's very safe and effective. So the technology in urology never stop. Every day every few months we have a new technology coming in the field. So this put a lot of challenges in all the doctors, especially urologists, to develop themselves, reading, studying, and then practical, using the same technology. Yeah.
It's actually fascinating when you learn that actually technology is still improving, and especially when it's connected to human lives, it's helping people. But we talked about technology. Let's talk about maybe different techniques, projects, or services that you hope in the future will be implemented.
Okay, so I'll take specifically about the prostate because this is my field of interest, prostate disease. Prostate disease has a multiple surgical techniques. Most of the techniques that we do right now may affect the ability to achieve kids for the men. What we are doing right now, we have a very nice research still in the ethics committee of the Ministry of Health, Kuwait Ministry of Health. Once we got approval, that will help the patient in relieving the prostate enlargement with preserve their ability to achieve kids. So this is one of the coming projects. We to have a lot of products, alhamdulillah, and multiple research we've done. Most of them focus in the prostate enlargement.
I mean, it's always great to hear that, technology in all forms of the medical field is advancing and helping patients, having better treatments, having better recovery process. Technology, especially now with AI, is rapidly improving this. So it's such a great thing to hear. But Dr. Abdulrahman Alkandari, we are going to take a very quick break. I'll come right back after the break.
And welcome back, dear viewers, to the Untold. We are still with Dr. Abdulrahman Alkandari, a doctor and urologist, and we were just talking about how research and different technology are actually improving health and patients' health here in Kuwait and overall.
It is, yeah, and honestly, when it comes to technology, like we discussed before the break, it's fastly, rapidly moving, advancing, and trying to keep up with the latest updates. Now, of course, we also discussed the challenges when it came to choosing your field. But what about the specific challenges when it comes to urology? Like a lot of the things when it comes to maybe the diagnosis, that talking to the patients, a lot of patients may feel like, it's such a private matter that they're too uncomfortable to seek doctors. So what could be the challenges here?
I would say the challenge is not in our routine work, because the technology really make it easier in terms of diagnosis, in terms of management. But the challenges maybe happen in specific cases when we have a disease, a very bad disease that even bypass the technology, and we have to go for the old traditional techniques with open surgery. Still, it is valid and doable, but it's become rare. And when the disease level and reach the very high level that we cannot use the technology, here we do have a challenges. Yeah.
Dr. Alkandari, maybe being a surgeon, or maybe even as a normal human going into surgery, I would feel maybe terrified. But you as a doctor, what advice would you give people who want to be a surgeon or a doctor in surgery?
You mean the way that we balance between our work and our life? You can't, basically. It's really tough. I would say the being a surgeon and being a busy surgeon need to have to a lot of sacrifice. You might affect it socially. Yeah, definitely. You might affect it socially. You cannot go for the family gathering as you do before. You have to spend a lot of times with the patient in the OR. If you want to be busy, you can be busy easy. But the balance would never be as what you used to do before. No, definitely have a very big commitment. If you want to be a busy and a very good surgeon, you have to sacrifice part of your family. In the end, you have some commitment with your close relatives, I mean, your parents, your family, your close family. But if you want to be this social man and a good surgeon, I don't think that you can do both of them.
Dr. Alkandari, what about young doctors who aspire to be surgeons? Maybe you could give them advice about what do they think about before surgery and different advices.
Yeah, definitely. The first thing I would recommend them to do, start reading, because everything is starting from the reading. Then they have to think, to operate, and after training, definitely, and join a training program. They have to operate, watch their patient after the operation is very important, document the finding, and if it is able, they can do a research. A research usually is a very good push for the patient, for the doctors themselves, give them more confidence, give them the way that they monitor their patient, monitor the outcome of the surgery, and improve their skills and their techniques, surgical techniques.
It is. And you know, speaking about improving techniques and speaking about these young doctors, here on the Untold, we had the honor of having, you know, several doctors here. And I think a lot of the shared sentiment is that one of the most difficult parts about being a doctor is not exactly the illness itself or the treatment of it or the surgery, but dealing with the people, you know, talking to them, explaining to them the procedure. You have sometimes people who don't understand, you know, the intricate things about the procedure, so you have to really maneuver a landmine while you're talking to them. Have you noticed such thing, you know, in dealing with the patients?
And definitely, even the terms, the medical terms, you are talking about something, and maybe the patient is understanding the other way. The way that you explain the complication should be during, like, when you're counseling the patient for the surgery, you have to mention all the complications, all the alternative procedure that you can do for the patients. You have to spend a very good time with them, because you will notice most of them they have some, I would say, they are scared and afraid from some simple procedure that's really very rare to have a complications.
I think it's amazing how doctors actually do this. But Dr. Alkandari, how would you say a person or a doctor can balance their life between maybe if their family and their career, especially being a doctor? Maybe you talked a little bit about this, but can you talk to us in details?
In general, like to do the balance, you can do the balance definitely with your close family. Definitely, you have a very good time for your family, for your kids, or your wife, parents. But you have to sacrifice a lot of activities that you used to do before joining a medical field, and especially in the surgical field in general. So you have to sacrifice the 1 year. Basically, you will not have a very good time to go for daily duania, for example. If you go once weekly, that's what should be fine. The message that I want to deliver to be a surgeon is sometimes is tough, and you need to sacrifice. Yeah, this is what I want to say.
It is. And now, speaking about being a surgeon, especially when it relates to being a successful surgeon, what do you think are some key, you know, factors or key abilities that they should have to be as successful of a surgeon as they can be?
Yeah, it's the same principle that first you have to read, and then you have to think about the technique that you will do it, monitor the patient, keep observing the outcome of your surgery. You have to closely follow up the patients, document your results, and in the end, if you can publish it, that would be very nice. And with this, you will notice that you can improve your skill. Also, this technique that you did was not the best for the patient, and you want to move to the other technique stuff. And this is how you develop yourself. Another thing that we used to have multiple courses, multiple conferences yearly. You have to attend as a surgeon a lot of events around in the region, in the world. In these events, everybody will come and accumulate his experience. You will look to their experience, sharing experience with them. That will definitely will enrich your knowledge, your skills.
I would say that because these events, like you said, doctor, gather a lot of people from the same field or even different fields in medicine. So it's like benefiting from all of these people at once, especially being there and talking with them, maybe networking with them, getting more knowledge on your field and different fields as a doctor. But Dr. Alkandari, what would be an advice that would you give our viewers about being keeping their health and for health overall?
I would talk on my side, like as a urologist, I'll talk about two issues currently around. Now we are in the summer, so we see the weather is very hot outside. So the dryness is bad for the urology system, specifically for the kidney. So I would recommend them to have adequate fluids. I'm talking about 1.5 liter to 2 liters per day of water, other than other fluids that maybe will reach 2 liters. So dehydration is very bad for your kidneys. It may induce more stone in the kidney. This is for the kidney part. And for the prostate, I would recommend the patient, all the male above 50, to do a screening for the prostate, just to avoid any incidence of prostate cancer or other diseases. This is for the in general, talking about for the whole population. Yeah.
And are there like any specific symptoms that a lot of people may have, but they often ignore or think it's normal?
Yeah, we have some red light, and the very important, like fatal, I would say, fatal symptoms. One of them, I would say, the blood in the urine. And blood in the urine is very important. So if any patient has this problem, he should immediately visit any emergency like nearby. Other that, the symptoms, any old people, he should ignore the peeing issues, especially waking up at night multiple times to pee. This may reflect on his health condition, may reflect in his heart. Some studies showing it, the waking up at night, we call nocturia. So waking up at night multiple times to pee may affect his heart and induce myocardial infarctions. So this is important. Any patient who's suffering used to have experience with multiple renal stones, we call that urolithiasis. During the summer, if he notice any pain, he should visit the emergency.
Doctor, you mentioned that you would recommend every male above 50 to do the screening. Is for the prostate, if I'm correct, right?
Prostate cancer.
Is it a genetic thing, or is everyone recommended to do it, or is it maybe a family condition, or can you tell us a little bit more about that?
So if there is a positive family history of prostate cancer, especially in the father's branch, it's better to do it in 45. Once he reaches 45, he should do it, the screening, which is a blood test, just a blood test every year, once every year. He can do it once every 2 years. But in general, once every year. In case there is positive family history of prostate cancer after 50, all the males should do it annually as well. And if there is a positive genetics like breast cancer in the female, also there is some connection between the breast and prostate cancer. It is the same gene. Mm-hmm. So they should do it earlier in 45.
So I think that the safest bet here is that whenever you feel something's wrong, don't wait for it. Go and check it out.
Yeah, and general talk, but in the prostate cancer specifically, you will not have symptoms. So it is asymptomatic disease. This is why we do screening regardless there is symptoms or not.
Yes. And now, speaking about those symptoms, you did mention earlier that sometimes people who wake up constantly at night. Now, a lot of people, say we drink a lot of water at night. How can I separate that I'm waking up normally because I'm drinking a lot of water, and then between I'm waking up because there's something wrong?
Yeah, the easiest way, we tell them stop drinking water 2 hours before you go to the bed and reassess yourself. If you're still waking up after you quit this habit, so there is something is warning.
Dr. Abdulrahman, where would you see your field, urology, in 10 years' time? Would it be improved? Would it have anything new in this regard?
I think it will be more with high tech, definitely. AI will play a very important role in the surgical techniques. Currently, we do have a prostate surgery done completely with robotic. We call that aquablation. And this is very new. Still, we don't have it in Kuwait. Inshallah, hopefully we got it, inshallah, within a few years or months. We don't know. We don't have plan yet. The robotic surgery is really very rapid development generally in all surgical specialty. So we expect to have high tech, less hand surgeon, maybe less surgeon in the future. I don't know. So this is what we expect in 10 years.
Yeah, I've been hearing a lot of offhand surgery, or maybe robotic surgery, as they call it, and I'm actually happy to see technology and different new devices actually helping, because each thing have a negative side and a positive side, and I think this is the a positive side regarding medicine and everyone here in hospitals in Kuwait.
I mean, yeah, honestly, hopefully the audience can rest assured to know that even if we are at a very advanced stage of technologies when it comes to the medical field, updates and, research are constantly on the move, on the go. Companies are trying to enhance and better all of these research facilities. Now, that being said, Dr. Abdulrahman Alkandari, I do want to thank you for joining us here on The Untold. Honestly, this has been really insightful, really helpful. So thank you for taking the time out of your day to join us.
Thank you for your time, Abdullah and Abdullah. Thank you so much for your time. Thank you for the team. Thank you for the audience. Thank you so much.
Well, with that, let's wrap things up. Well, that was Abdulrahman Alkandari, a doctor and a urologist. Abdullah, we talked about many things today regarding being a doctor, how to deal with people, and what's the important traits to be a surgeon, and how to give maybe people maybe sometimes bad news. Sometimes you have to be honest with them. What stood out for you, Abdullah, in today's interview?
I mean, honestly, every time we talk to doctors here on The Untold, the human factor, right? The way, because when you are a patient and you go to see the doctor, you go and you see a doctor, right? You don't think beyond the doctor. But when we have them on The Untold, they talk about their, struggles, their personalities, their issues, their difficulties, their journeys and experience. It always gives them so much more, right? So much more, I would say, fluidity, so much more experiences, so much more definitions. And I'm always glad to have these conversations.
True, Abdullah. It was fascinating to see the human side of being a doctor, not only the being there with the equipment and all this. Sometimes when you talk about how to deal with humans, it's actually fascinating.
It is.
And with that, dear viewers, stay tuned for another episode in The Untold.